Hi.
Hi.
My name is Carly Burlon.
Nice to meet you.
I'm going to be your advanced practice nurse practitioner today. How are you doing?
I'm good.
Can you tell me your full name?
Chase David Kovacs.
Good. And your date of birth, Chase?
09/27/1996.
Good. And where are you at right now?
Poland, Ohio.
Okay. And what year is it?
2021.
Can you give me the month?
December.
And the day?
5th.
Perfect. Do you know what day of the week that is?
Sunday.
Absolutely. And if you had to give directions going back towards Youngstown from here, which way would you go?
I'm going to hang a Lucy out of the driveway. I'm going to head towards the middle of Poland Village. I'm going to hang a Roger at the light, go through 2 lights to come to the 3rd light. It then goes to 35, watch some Poland cops. And then I'm going to jump on 680. I'm going to go 680 all the way back into Austintown, get off on Route 11, hit Route 11 to Mahoning Avenue 46, and I can't tell you anywhere farther because that's a little creepy.
Okay, absolutely. Good job, you passed the test.
Thanks.
If I threw a rock in the water, would it sink or would it float?
Sink.
Okay, perfect. I'm going to have you remember 3 words for me, okay? I'm going to ask you them 3 times throughout our assessment. This is the first. It's going to be dog, pizza, church.
Okay.
Can you repeat those back to me?
Dog, pizza, church.
Perfect. Okay. How's your emotional status been?
Pretty good.
Good. I'm glad. I'm going to ask you a question, and you're going to tell me which of these 2 out of the 3 words are similar, okay?
Okay.
We've got ketchup, mustard, and a ball.
Ketchup and mustard.
Perfect. And if you were going to make a hot dog, what would you put on that hot dog?
Ketchup and mustard.
Perfect. Okay. I'm going to ask you an arithmetic calculation. You're going to tell me what comes next, okay?
All right.
3, 6, 9.
12.
Perfect. 2, 4, 6.
8.
Good. Okay. Now I'm going to test your writing ability.
All right.
First, I'm going to write a sentence, and I'm going to have you read it out loud, okay?
Okay. I want to look.
And can you read that out loud for me?
The dog is gray.
Perfect. And can you write a sentence as well?
Yes, I can.
Okay. The hot dog is a meal best served frozen. You got a subject and a predicate in there. Great
That's
job.
right.
Okay, and I can take the pen back for you. I'm going to have you draw a number in my hand, okay?
Okay.
Can you draw me a 6? Good. And then I'm going to take your hand. Close your eyes. I'm going to do the same thing. You just tell me what number I'm drawing, okay?
2.
Yes. Good job. All right. Can you repeat to me back those 3 words that we talked about a little bit ago?
Dog, pizza, and church.
Very good. Okay. And I'm going to give you a hypothetical situation, okay? You're
Okay.
driving down the road and you get to a stop sign. What are you going to do with your car?
Stop.
Good. Okay. And I am actually going to have you get up for me.
Okay.
And you are going to walk. I'm going to have you walk just straight in a
Okay.
line. Regular. Good. And then when you come back, can you put your toe in front of your heel? Yep. Tandem walking. Good.
Keep doing it.
Yep. Good. Okay. And can you stop and face the camera? Stand straight. Close your eyes. And put your arms out a little bit. Okay. You are good. You can sit back down for me. I'm going to hand you this object. You're going to tell me what it is.
That's a ball.
Good. And can you throw it overhand for me?
Yeah. Right.
Perfect. Okay. And now we're going to test your cranial nerves, okay? Before we do that, can you repeat to me those 3 words that I had you do?
Dog, pizza, church.
Perfect. All right. We are going to test all of your cranial nerves except for your olfactory nerve because I'm pretty sure you can smell.
Mm-hmm.
So I'm going to start with your optic nerve, okay?
Okay.
I'm going to stand in front of you and just follow my finger. Okay? And then I'm gonna have you follow it with this side. Good, and this side. Good, perfect. And then I'm going to have you put your finger on your nose, and you're gonna put your finger wherever my finger goes, okay? So go ahead to my finger, and back to your nose, into my finger, and back to your nose, to my finger, back to your nose, to my finger, back to your nose, to my finger, back to your nose. Perfect, good job. I'm going to have you scrunch up your face. Good, and frown. And you can take your finger off your nose.
Okay.
Thank you very much. Okay, now I'm gonna test your acoustic.
Oh boy.
This is just gonna be a vibration. I want you to tell me if you hear it in both ears, okay?
Okay. Should I close my eyes?
You can.
Okay.
Both ears?
Mm-hmm.
Okay. And do you hear it more here or here?
The first one.
Okay. And what about here or here?
The first one.
Perfect. Okay. And very last but not least, I'm going to just have you close your eyes. I'm going to touch you somewhere on your body, and you're going to tell me if you feel that touch, okay?
Okay.
Can you tell me where my hand's at?
Forearm.
Good. And what about now?
Bicep.
Good. And what about now?
Forearm again.
And one last time?
Bicep.
Good. And can you feel this both sides the same?
Yes.
Perfect.
Forearm to bicep.
Okay, how about now?
Neck.
Good. And over here?
Other side of the neck.
Good. And can you feel this going down both your legs? The
Yes.
same. Perfect. And that about concludes the neuro exam that we're going to do. Now we're going to test your musculoskeletal exam, okay?
Okay.
First of all, I'm just going to take a look at your body. You look very symmetrical,
Thank you.
and it looks like all of your skin covers your muscles very well. I am going to lift your pant legs if that's okay with you.
Sure thing.
Okay, I just got to be able to see your kneecaps. Okay, and you can relax your legs for me. So I'm going to start off just by palpating some of your visible joints, okay?
Okay.
So we're going to start off with your wrists. I'm just feeling for warmth, crepitus, tenderness.
Mm-hmm.
Any pain?
Nope.
Okay, now we're going to go through each and every body system just a little bit more fine-tuned, okay? We're going to start out with your fingers. Can you hold your hands out for me? Okay. And I'm just going to palpate each and every joint. Good. No tenderness. Okay, I'm going to have you flip your hands inward and outward. And can you scrunch them up for me? And hyperflexia. Good. And give me a thumbs up. Perfect. Can you stick your pinkies up? Perfect. Okay. Now I'm going to test your elbows, okay? You can relax your arms. Any pain or tenderness?
Mm-mm.
Okay, can you push against my hands? Good. And push in. Perfect. Okay, and I'm going to have you turn your elbows in for me. And turn them out. Good. And move them like this. And put them back. Perfect. Now I'm going to test your shoulders. Just feeling them. Okay. And I'm going to have you shrug your shoulders up against my hands. Good. And back down. And can you lift your arms out for me? And back down. Perfect. And can you bring your arms in like this? And out like this. Good. And we're going to test pronation and supination. This one's supination. And then pronation. Good. I'm going to look at your cervical spine now. You can relax. Any pain?
Nope.
Okay. I'm going to have you turn your head to the right and to the left. Good. And center. Can you put your chin down to your chest and up to the sky? Perfect. All right. You can rest. We're going to check your cervical spine. I'm going to have you stand up for this one, okay?
Okay.
For the cervical, thoracic, and lumbar, I'm just going to palpate first. Make sure that your spine is neutral and aligned. Okay, I'm going to have you bend over and touch your toes as best as you can.
Cool.
Okay, and I'm just looking for alignment again. No problems with scoliosis or anything in the past, correct?
No, ma'am.
Okay, you can stand up for me. And I'm just going to percuss against your spine now while I'm back here. Good. And can you rotate your whole entire body to the right?
Like this?
Yep, at the hip. And to the left. Good. And center. And I'm going to have you just Lean your body to the right, to the left, forward, and if you can put your arms to support your back and lean backwards for me. Okay, perfect. And you can have a seat again for me.
It's like a dance move.
And I'm going to just test your knees now as well.
All right. Can you get my pant legs up?
Yeah.
Okay.
First, I'm just going to inspect them. Feel them for any warmth or crevices, which I do not feel. Okay, I'm going to have you push against my hands. Good. And pull back. Good. And I'm just going to have you rotate your one leg out.
Like this?
Yep. And your other leg. Good. Okay, you can put it back. And I'm going to do the same with your feet. I don't feel any crevices, any swelling, any redness, any warmth. I'm going to have you move your feet inwards and out. Good. And then I'm going to do your toes next.
Okay.
You have all 10 digits. I'm just feeling to make sure that there's no problems with them. Okay, and I'm going to have you dorsiflex your feet. You're going to go like this and spread them. Good. And then plantar flex them. You're going to point them down. Perfect. Can you turn them inwards like this?
This?
Yep, and outwards if you can. Perfect. Okay, now I'm going to just check your reflexes.
Okay.
We are going to start out right here in your wrist.
Mm-hmm.
You're just going to feel me tap with this hammer, okay?
All right.
And it won't be a big reflex. It's just I'm gonna look at your muscle, okay? Okay, good. And then I'm gonna tap my finger right here. Good. And I'm gonna have you move your arm in here. Okay. And I'm gonna do the same thing over here. Good. Good. And good. Okay. I'm gonna do the same thing with your legs.
All right.
And just, you're going to feel a little tap right here, okay? Good, and over here. Perfect. Okay, and then I'm just going to tap the back of your foot, okay? You can
Okay.
relax this. Good. Sorry.
It's okay.
Okay, and I'm just going to check for your Babinski reflex.
Mm-hmm.
So you're going to feel my finger on the bottom of your foot, okay?
Okay.
Okay. Good, and you were negative Babinski reflex, which is a good sign. Do you have any questions for me?
I don't think I do.
Okay, and I'm going to see you next week where we put it all together, okay?
All right. Can't wait.
It was a pleasure seeing you again.
Yep, you too.
Thanks, have a great day.
Yep, you too.